Hi there, welcome back to the series of treating menstrual period pain videos. Now today, I got something really interesting to share with you. But before we dive in, I want to show you the incredible transformation in Nina's tongue before and after the treatment. Now the difference is as clear as day, and it's a sign that the treatment has been effective. If you are curious about how we achieve these results, make sure to follow us and watch the entire series of videos dedicated to Nina's fascinating case study. Now, in traditional Chinese medicine, there's no specific term for adenomyosis. It's simply referred to as menstrual period pain. To understand the underlying causes and provide effective treatment, we rely on accurate diagnosis. During the initial consultation, we examine the patient's tongue, pulse, and perform auricular diagnosis, which focus on the ears. By the way, if you want to learn more about auricular diagnosis, check out this video above. Unfortunately, explaining auricular and pulse diagnosis in this short video would be a bit challenging. So today, we'll be only focusing on the tongue diagnosis for this case study. In Chinese medicine, when we examine the tongue, we apply the holographic microsystem principle. Basically, what it means is the different areas of the tongue corresponds to different areas of our body. So it's like visualizing a person facing downwards. The head lies at the tip of the tongue, and the bottom lies at the back of the tongue, near the throat. And those other parts of the tongue then correspond to other body areas as shown on this picture. The size, the thickness, color, shape, cracks, and coating of the tongue provide us with variable insights. It means we are able to determine the internal organ changes by collecting this information. For instance, we pay attention to the thickness and color, whether it's white, yellow, black, and so on, to find out whether the internal organ has problems or not. Now, let's take a closer look to Nina's tongue. Now, starting from the tip, we can see some red spots, indicating heat rising to the head. This suggests that Nina may be dealing with stress and insomnia. Moving on, the center of her tongue is somewhat raised, which is a sign of stomach bloating. And if we look from the tip to the back of the tongue, we can see in the middle there is a curved line, indicating the possibility of scoliosis and tension in her lower back. Furthermore, the slight wetness on both sides of the tongue points to a disturbance in the liver and gallbladder organs, hinting at excessive worry and stress that Nina may be experienced. Now, the most intriguing part is the circled area that captures our attention. The coating in that area appears to be rather unusual, and it looks like a sticky type of coating, which indicates the body type of dampness in Chinese medicine. This dampness condition indicates the body waste has been lingering in the body for a very long time and has not been eliminated well by the body. A good analogy of such I can think of is like the oil stuck inside a range hood when there's not enough regular cleaning, which sounds very difficult to remove without hard work. These specific tongue coatings indicate potential health issues in the corresponding areas of the body, which in this case is below the navel, including the urinary and reproductive systems. To make it crystal clear, Let's compare a normal tongue base with a tongue base affected by adenomyosis. On the left side, you can clearly see that the circled area looks disorganized and irregular. On the other hand, the image on the right shows a normal appearance of urinary and reproductive systems. I'm sure that you can easily spot the difference and recognize the problem area from these two tongue pictures. By now, I bet you have learned a thing or two about reading someone's health through their tongue. Pretty fascinating, right? But hold on, we've only scratched the surface. In the next video, we'll delve deeper into this case and discuss acupuncture and herbal treatment approaches. So stay tuned for that. Thank you so much for watching this video. If you found this video insightful, don't forget to give it a thumbs up and share it with your friends. And remember, I will catch you in the next video. Take care.